Hi, thanks for joining me for a brief introduction to prolonged exposure therapy for PTSD. I'm Dr. Sandy Capaldi, and this video is a brief excerpt from a longer training about foundations in trauma therapy.
PE is one of the strongest, most well-researched treatments for PTSD, as we said. It was developed by Edna Foa, who was the director of the CTSA, the Center for the Treatment and Study of Anxiety, where I work. She's currently semi-retired. But let's think a little bit. I talked a little bit about what the goals of PE were. Let's talk about, kind of the core principles of PE a little bit. The principle at the heart of PE is that avoiding trauma-related thoughts or feelings or situations is really what keeps PTSD symptoms active. After we experience a trauma, people naturally want to avoid anything that reminds them of what happened. Avoid the memories, avoid the emotions, avoid the sensations, the places, the people, internal cues like body responses. And avoidance makes perfect sense as a survival strategy in the short term. Again, right now, it makes sense to want to avoid something that's going to be upsetting, that's going to make us feel fear. But the problem is that avoidance teaches us that these reminders are dangerous, even when they're not. So every time a client avoids thinking about what happened, their fear grows, right? Their world shrinks, and their PTSD symptoms stay alive. So PE directly targets that cycle. We're helping people to break the cycle of avoidance, to allow themselves to process the trauma and realize that the memories, the triggers are not dangerous. So we're helping them approach these memories and these situations that they've been avoiding slowly, safely, systematically, right? And there are, a couple of major components that help that to happen that I'll talk about in a second. But the reason this works is because it helps the client to reduce the fear and distress around it by kind of updating the understanding of the trauma. Instead of, sort of storing it as, some kind of current threat, we're able to, delegate it as a past event so that we regain a sense of mastery over, our internal world. We start to expand life in the external world. Okay, so instead of organizing everything around avoidance, right, we're expanding the things that we're able to do again. And that's why PE is so effective, because it's treating the mechanism that is actually keeping PTSD alive. Okay? So PE is built on a very simple but powerful concept. And that is that avoidance keeps PTSD alive, and that the safe and structured approach to the memory and the triggers are going to be what helps us to heal. Okay? So let's kind of take a quick look at the components that help this to happen and what PE actually looks like. Okay? So PE is a structured, generally time-limited, evidence-based treatment for PTSD. We see that people are typically doing PE for about 8 to 15 weekly sessions. And what makes it so effective is that it directly targets, like we said, that core mechanism that keeps PTSD going, the avoidance. So in PE, clients are learning to safely approach what they've been avoiding. And through that process, the brain relearns that the trauma is over, that reminders are not dangerous. So to do that, we have two kinds of exposure, right? Two kinds of approach. The first is imaginal exposure. Imaginal exposure is done in session with the therapist, and we're asking the client to recount the trauma memory in detail, aloud, with our guidance. We help them to, slow down, stay present, move through the memory instead of away from it. And we repeat this recounting over multiple sessions. These exposures are recorded, audio recorded, and the client listens to that recording at home in between sessions as part of the ongoing process. So what this does is it helps them to learn that remembering the trauma is not the same as being in danger. It's not the same as having experienced it. And so over time, the memory becomes less overwhelming, less vivid, less emotionally charged. The other kind of exposure, in vivo exposure, focuses on real life situations that the client's been avoiding because they trigger distress. So you and the client would work together to create an exposure hierarchy, a step-by-step list of avoided situations ranging from easier to more difficult. These might be things like, going to a crowded store, driving on a certain road, sitting with your back to a door, all of these kinds of things that either remind you now of what happened or feel like they're intolerable for you. And we have the client gradually approach these situations in real life, starting with the lower intensity steps and moving up as they gain confidence. And so with each exposure, they're learning, I can handle this, right? I don't need avoidance in order to survive. Together, these two kinds of exposures or approaches create a very powerful combination. The client learns to face the internal reminders and the external ones. And each time they approach instead of avoid, they see that their fear decreases, their world expands, and the PTSD symptoms start to loosen their grip. So it's a very structured, clear, and deeply empowering therapy. For many clients, it's absolutely life-changing. Now, alongside these two components, there's two other essential components that actually support this work, psychoeducation and processing. And these pieces help clients understand what's happening, why it works, and how to integrate what comes up during exposure. So psychoeducation happens early in PE and continues throughout treatment. This is where we're teaching clients about common reactions to trauma, how PTSD symptoms develop, why avoidance keeps symptoms going, what to expect during the exposure work, how the brain and the body respond during treatment, right? Helping them to feel oriented, feel prepared, right? Sticking to all these trauma-informed principles that we've been talking about. It helps to reduce, fear and confusion about what they might be getting themselves into, and instead is helping to empower them to understand their own reactions. A big part of the psychoeducational piece is helping clients to see, what I'm experiencing makes sense. And that alone can help to lower distress and increase engagement in the treatment. And the other component, processing, happens after both imaginal exposure and in vivo exposure. Processing is where we're gently exploring with the client what emotions came up for them, what thoughts appeared, what did they notice in their body, what surprised them, what felt new or different, what did they learn about themselves or about the world or about the trauma. The goal is to gain a new perspective on the trauma, one that's not driven by fear or shame or, some of these different unhelpful beliefs that they've been stuck with. So through processing, clients get to see, I can handle this. This memory doesn't have to control me anymore. I survived. right? So processing is where the integration of all of this happens. It's the meaning making that, helps to support the long-term healing. So these two elements, psychoeducation and processing, are what hold the exposure work. They help clients to understand what's happening, make sense of their internal experiences, and build a more adaptive relationship with the trauma and with themselves so that they're able to move on, move past it, have it be something that was in the past, but that they're able to, kind of effectively move on from. Now, I've been saying that when we talk about evidence-based trauma treatments, that prolonged exposure therapy is consistently, one of the most effective options that we have. This slide highlights some of the core points about PE's safety and effectiveness. We know that PE produces significant improvement in about 80% of patients and clients who have chronic PTSD. So this kind of helps to emphasize just how strong PE's outcomes are. For clients who've been suffering for years, sometimes decades, right? The fact that PE can lead to improvement for the majority of people in such a short time frame, right? 8 to 15 sessions is incredibly encouraging, right? PE is highly effective across various types of trauma, right? So all of the different kinds of, again, those big T traumas that we were talking about are, fair game when it comes to PE and, reducing PTSD symptoms. While, it is true that PE, is intense, right? Initially, there may be a little bit of an increase in distress. It is a safe and controlled process, right? PE does ask clients to approach difficult material, right? Memories, situations, or internal sensations, which means that the distress can rise, early in treatment. If we've been avoiding all this time and now we're facing, right, we're going to experience a little bit more distress. But the process is intentionally structured to be gradual and therapist guided, right? And so instead of, this idea of re-traumatizing, which I always put in air quotes, instead, we're fostering mastery, we're fostering control, confidence, new learning. And clients get to see that they can face what they've been avoiding without getting overwhelmed, right? Through our teamwork together and our guidance. We see that in PE that clients are often seeing a reduction in their symptoms even after just a few sessions. It's something that many people actually find surprising, that improvement often starts early. As people start to approach the avoided memories and situations, they experience real-time relief and increased functioning. And that early progress helps to build confidence and momentum in the treatment. So one of the questions often when we hear about all the good things about PE is, who is this for? Like who's a good candidate for PE? And really, PE is suitable for people who have experienced or witnessed, some kind of traumatic event and developed PTSD. So PTSD is the key here, right? They have to have PTSD symptoms, okay? Including, people who have other comorbidities, right? Depression or other anxiety disorders or substance use disorders, all of that, right? People with PTSD can typically benefit from doing PE, right? So PE isn't just for simple single incident trauma, right? Necessarily, it's appropriate for a wide range of PTSD presentations, but PTSD, like I said, is what we're treating. So that's the key. Okay? So overall, PE is extremely effective. It's well-researched, it's safe. And while it can feel intense at times, the structure, the pace, the therapeutic guidance makes it a controlled and empowering process, right? And again, one that truly helps clients to reclaim their lives. I can't tell you how many times I've heard that phrase from therapists and clients alike, that they were able to get their lives back.